Thank you for your interest in fellowship training at the University of Connecticut. My name is Lisa Church, and I have been on faculty here at UConn for almost 10 years and have served as program director for about 9. We believe that our program offers a comprehensive, diverse, and balanced educational approach to the ever-changing and expanding field of ID. We hope this introductory informational video sparks additional interest and generates questions and discussion, and we hope to have those discussions with you soon. I regret not being able to welcome you to our beautiful campus this year, but trust that you will get a feel for the facilities and the surrounding area by reviewing some of the video footage provided on our website. I look forward to meeting you soon. I'll start by reviewing the basic structure of the program. Ours is a 2-year fellowship divided into 13 4-week block rotations per year. Each year consists of 8 inpatient consult blocks and 5 electives. One of these is a selective, microbiology during the first year and solid organ transplant ID during the second year. Each fellow has 1 4-hour session of continuity clinic per week at one of the 4 sites. This remains consistent throughout the 2-year fellowship. Tuesday afternoons are our dedicated academic educational period, consisting of ID board review, followed by faculty lectures from the core curriculum, followed by intercity grand rounds. Faculty, fellows, and rotating residents and students from each site participate in grand rounds. Content may include case presentations with literature review, journal clubs, as well as local, regional, and national guest speakers from time to time. First-year fellows participate in the Academic Leadership Skills course, along with fellows from other medicine subspecialties, in order to broaden their abilities in areas of scholarly activity such as statistics, writing for the medical literature, interpreting the medical literature, giving and receiving feedback, to name a few. What are the benefits and disadvantages of rotating at several different hospitals? We believe the positives are many and the negatives really very few. By virtue of having assigned rotations at 4 different hospitals, fellows who train at UConn are exposed to a wide variety of practice settings, patient and provider demographics, hospital formularies and policies, faculty mentors, and institutional cultures. They work with truly top-notch ID faculty at each site, with different backgrounds, practice habits, areas of focus, allowing them to cherry-pick aspects they admire and want to emulate. Rotating in 4 care environments that each have their own idiosyncrasies allows fellows to develop their own ideas of how best to practice and what kind of environment they prefer to practice in, while giving them the flexibility and ability to practice in multiple environments. So, they graduate from our program truly prepared. What are the disadvantages? Multiple record-keeping systems? Not so much anymore. All systems in the consortium now use Epic, and all are connected by Care Everywhere, which creates a more seamless transition when patients move between systems. Sure, when starting at a new site for the first time, there's a definite learning curve, from the geography of the place to remembering passwords. These issues quickly work themselves out, and by the second rotation are second nature. Transportation is one issue, in that fellows do need a car to get from place to place in the greater Hartford area, although no location is more than 9 miles or so from another, and traffic is relatively light. So this ends up being not so onerous. Also, there's not a lot of travel on a daily basis. Fellows spend the lion's share of their time at their primary site during a 4-week block, with the exception of Tuesday afternoon didactics at UConn and Thursday morning clinics. Subarus are very popular in New England, and I hear they're releasing a hybrid soon. Next, I'll provide some information about each of the 4 primary sites where ID fellows rotate. Although we are the smallest of the 4 hospitals, UConn Health serves as the mothership, so to speak, for the graduate medical training programs, including ID. We are a university hospital with schools of medicine, dental medicine, and the Graduate School of Public Health on our campus and physically attached, allowing for a great deal of collaboration in terms of research as well as opportunities in medical education. Our fellows are very involved in teaching, not only the internal medicine residents, but also the medical students, participating in the second-year microbiology course, among other roles. Many buildings on our campus are new, including the University Hospital Tower in the lower right corner, with all single rooms, hardwood floors, floor-to-ceiling windows, and local Connecticut artists' work on the walls. In the center is the new outpatient pavilion, where our clinics are, as well as academic offices, allowing for easy communication and collaboration. On the top right is the new Jackson Laboratory for Genomic Medicine, a satellite campus to the primary location in Bar Harbor, Maine. We in ID also work with investigators there, in particular on areas related to microbiome sciences. Hartford Hospital is the largest and probably the busiest of our sites, with over 800 beds, located in downtown Hartford on the south side. Hartford Hospital is flanked by Connecticut Children's Medical Center and the new Bone and Joint Institute. Hartford is also home to the Comprehensive Liver Center, where transplant patients are managed, and has a busy HIV service, including a dedicated HIV inpatient service, which is rather unique in this era. Pictured here are the Bone and Joint Institute on its first birthday, on the lower right, and Connecticut Children's in the upper left. Most fellows choose to do electives in pediatric infectious diseases at Children's, although this is not required. We have a close relationship with the division in terms of academics and research collaboration. Our respective faculty in pediatric and adult ID have been working together for many years, and Connecticut Children's faculty have academic appointments at the School of Medicine. St. Francis is our other large urban medical center, also quite busy, on the north side of the city. St. Francis also has a bone and joint center and a dedicated orthopedics infectious diseases attending who trained here at UConn several years ago. Faculty there are excellent and dedicated to teaching. Our residents and students rotate there as well. The Trinity system is national, and St. Francis is the largest and flagship member of Trinity Health New England. St. Francis recently established a relationship with Yale New Haven Smilow Cancer Hospital, pictured here. Last, but certainly not least, is the Hospital of Central Connecticut, another member of the Hartford Healthcare Group. This is a medium-sized community-based hospital in the city of New Britain. While designated as a community hospital, its faculty have appointments at the UConn School of Medicine and are quite academically bent, with many receiving teaching awards from students, residents, and fellows each year. The Hospital of Central Connecticut houses the primary care and general medicine residency, also with a fantastic reputation for teaching, under the leadership of Tom Lane. It's no accident that many of the PCIM residents are interested in ID. Our fellows love rotating at this site. Hartford Healthcare developed an alliance with Memorial Sloan Kettering for cancer care and recently built a new cancer center, pictured above. This is a screenshot of Google Maps, so you can see the legend in the bottom right corner gives you a reference of 2 miles. 3 of the sites are noted on the map with UConn Health in the middle. St. Francis is not pictured, but would be right between Elizabeth Park and the Mark Twain Museum in North Hartford. I believe the longest distance is between the Hospital of Central Connecticut and Hartford Hospital, certainly no more than 8 to 10 miles. Depending on the time of day, there can be some minimal traffic on I-84, but it really depends on your reference point. So if you're used to traffic around New York, Boston, LA, or DC, this is nothing to write home about. In addition to your typical inpatient consult blocks and weekly continuity clinics, ID Fellowship at UConn offers several choices in the form of electives, as well as some additional experiences that are required. We follow ACGME guidance on scholarly activity requirements in that fellows can pursue a variety of qualifying activities. This can include authoring book chapters, reviews, or case reports. Fellows can also participate in original research projects. In fact, most fellows end up pursuing a research project mentored by one of our faculty here at UConn or at one of the other sites. Several fellows have worked with the State Department of Public Health on projects related to antimicrobial resistance, or with our ID pharmacist on antimicrobial stewardship-related projects. Selectives are basically electives that are chosen for you, one per year. In the first year, this is microbiology, so all first-year fellows spend their first month in the microlab learning the basics, free from clinical responsibilities. In the second year, this is solid organ transplants at Hartford Hospital, comprised of both inpatient and outpatient transplant experiences and a lot of didactics. All fellows must also complete an elective in stewardship, including participating in the IDSA online training program. Our fellows are fortunate in that they are able and encouraged to attend a wide variety of meetings and conferences each year. They each receive an educational stipend that provides reimbursement for much of this travel. All fellows attend ID Week both years, whether they are presenting or not, and most end up presenting one year or the other. All fellows also attend the ID Board Review course in Washington, D.C. early in the second year. Several attend other meetings such as CROI, the Liver Meeting, SHEA, or the Remington Winter Course. IDSA also holds various clinical and research meetings for fellows annually, which our fellows have also attended. We offer several core electives as well as many opportunities unique to UConn listed here. Perhaps the most unique is the elective experience in Kisoro, Uganda. Please find additional information on this and other global health experiences on our website, presented by the Chief of ID, Dr. Kevin Diekhaus. To wrap up with nuts and bolts, call consists of 1 weekend per call block, which amounts to 8 weekends per year. Fellows are able to select which weekend they prefer to work ahead of time. Almost always this will be at the site where they are currently rotating for continuity. Fellows are asked to work 1 holiday per year in addition to weekends. Similar to weekends, fellows are asked to select which holiday they would like to work ahead of time. There's fairly extensive information available on the UConn website about benefits offered through the Capital Area Health Consortium. These are quite generous and worth reviewing to inform your decision-making process. In addition, moonlighting is permitted for those who are interested. There is a daycare center on campus utilized for students, residents, fellows, and faculty alike. As I've indicated earlier, you will find this program to be extremely flexible in more ways than one. UConn offers a Master's in Public Health through the Graduate School, which can be combined with residency or fellowship. If interested, I would encourage you to review the information on the website and reach out for more details. Basically, it's a 42-credit program rather than the standard 48. 9 of those credits are your thesis, which could be completed after fellowship, and could be done remotely, which is frequently the case. That leaves 33 credits to be done in the classroom, or 11 courses. Another option that would be less time is the Public Health Certificate, which is 4 courses total: epidemiology, biostatistics, and 2 others of your choice. Where do UConn fellows end up practicing? As you can see, many end up staying on locally as faculty at one of our affiliated sites, which I believe is a very positive statement about the program and the people here. But graduating fellows are successful at finding employment in a variety of settings all over the country, from private practice in rural, suburban, and urban communities to academic faculty positions at very prestigious institutions to the VA and public health arenas. We are very good at helping make connections and facilitating the job search, including replacing those with visa requirements in certain practice settings. I personally have lived all over the country and outside the country, and Central Connecticut has been, by far, my favorite place to live. We are situated midway between New York City and Boston, with easy public transportation in either direction, allowing us to take advantage of all those big cities have to offer. At the same time, Hartford is a small city with a great deal to offer in its own right, from professional and collegiate sports to theater, symphony, art venues, science and historical museums, and city parks. Speaking of parks, the surrounding Farmington Valley is spectacular year-round and is truly a paradise for outdoor enthusiasts. I would be remiss if I didn't mention the Yankee Red Sox rivalry here, given Hartford is right smack in between. My own sense is that most favor Boston from this area, but I'll let you decide for yourself. Both ballparks are easily accessible, as is Dunkin' Donuts Park, where our minor league Hartford Yard Goats play. I hope this video provided some helpful information about our program. I welcome you to continue reviewing our website, our photo gallery, and other informational videos and testimonials we have posted. You can also find us on Twitter. Please contact us at the numbers or emails listed here with questions, comments, or concerns at any time, and I look forward to working together in the future.